Hello and welcome to our presentation on ending the stigma of mental illness in our community. We felt this was an important and appropriate topic for May, as it is Mental Health Awareness Month, and we are proud to be collaborating with Sinnissippi Centers Incorporated for this presentation. My name is Rachel Cocar, and I'm a licensed social worker here at KSB. I work in the Outpatient Behavioral Health Clinic. I work with outpatient clinical staff and offer support services and resource connection to our patients. And I also work with primary care clinics to help address any mental health needs patients may have and help them get connected to the right resources. I'm happy to be joined today by Gloria Martin, Director of Child and Adolescent Services at Sinnissippi Centers. Gloria is a licensed clinical professional counselor and has been a part of Sinnissippi Centers for a while. Gloria has a wealth of wisdom and experience, and we are grateful for her willingness to collaborate with us on this project.
Thank you, Rachel, for that kind introduction, and I'm very happy to be here today. Sinnissippi Centers and KSB has a long history of partnering together, and the importance of battling stigma has direct applicability to everything you do and we do together. So we thought we would start with a very brief overview of what is mental health stigma. So very briefly, when someone sees you in a negative way because of your mental health concerns, stigma can make mental health problems worse. Just because you have a mental health condition and without knowing you, people can make judgments or assumptions about who you are or how you are able to function. And so stigma makes it much difficult both for a person who's trying to get help for themselves and also possibly for their children and families. The National Alliance for the Mentally Ill, which is a strong advocacy organization for individuals with mental health problems, has identified that over 50% of individuals will experience a mental health disorder in their lifetime. Of those who do have a mental health illness, only around 40% will actually access care. A worldwide study of mental health care found that stigma of mental illness is one of the most significant reasons that people avoid seeking care. Addressing stigma is so important so we can remove barriers and help people access services as quickly and in a timely manner as possible.
The National Alliance on Mental Illness, also known as NAMI, has listed 6 types of stigmas that are related to mental illness. Public perception is a large part of the stigma surrounding mental illness. Believing mental illness is a weakness or a character flaw can shape a lot of the public's perception, and it can hinder someone's willingness to seek care. Labeling, that's another form of stigma. Once someone has been diagnosed with a mental illness, others can often use this to label or define that person, not realizing that that person is more than their diagnosis. This can reduce someone's personality or identity to just their diagnosis, rather than seeing that mental illness as just one small part of who they are. Stigma can also lead to social isolation, as those with mental illness feel unwelcome in social circles. They might choose to withdraw from society. And in essence, that isolation can worsen their symptoms. Discrimination, that's another form of stigma in which knowledge of mental illness can lead others to treat those who struggle with it differently than those without. This discrimination can be overt, such as when it might influence someone's employment, their ability to find housing, or it could be covert when it influences just how we treat others in general. So surprisingly, self-stigma also plays a large role in overall stigmatization of mental health, but it's not often openly discussed. Because of someone's upbringing or perceptions of mental illness that they might have been surrounded by, it might be difficult for them to not adopt negative views of themselves when battling a mental illness. Studies have shown that self-stigma was associated with a decrease in recovery for a large portion of the population who struggles with mental illness. And finally, barriers to treatment can keep people from seeking help, delaying care, or resulting in care that is inadequate. And this can also lead to a worsening of symptoms.
So how can we help reduce stigma? What can each of us do, or what can we do as a society? So NAMI outlines 4 ways that people can address stigma. One of them is just getting some basic education. It's important to reach out and kind of educate ourselves about mental illness, try and separate the myth from the reality. There's a lot of excellent online resources, especially through NAMI, but Sinnissippi and KSB also have resources, and it's important that you just look at a reliable source to get that information. Secondly, we can walk the walk. And what that means is we can look at ourselves and really think about, how do we perceive someone with a mental illness or a substance abuse problem? Do we just think of them as nuts or drunk, or do we recognize that they are individuals struggling with very significant problems? We can also look at ourselves and maybe be willing to talk to others about our experiences with depression and anxiety. We can spread the word and share resources on social media, be willing to stand up and correct or intervene if someone is using labeling in a social situation. You can also just let folks know you're a safe person to talk to. If someone says, I'm feeling depressed, rather than kind of changing the subject, you can say, well, tell me how that is for you. Finally, you can get involved. There's a lot of organizations and advocacy going on at multiple levels in the community, at the state level, and at the national level that help equalize benefits for healthcare, mental health services, funding for research, a lot of areas where we can just be more vocal and positive about changing stigma and making services more accessible for everyone with mental health and substance abuse problems. I'm going to take a moment and just highlight some of the services available through Sinnissippi Centers. We have a 24-hour crisis service available, and we have an 800 number, which is available around the clock, 7 days a week. We offer outpatient treatment for all ages in 5 locations. We provide school-based counseling in many area schools. We have psychiatric prescribers. We offer intensive community-based treatment. We have a drop-in living room located in Dixon. We have supported apartments for adults who have mental health needs and have a hard time living independently. Our recovery homes provide a sober living environment for those recovering from addiction. We offer home visiting for pregnant and new parents, and we offer a range of parent education and training, which are provided at no cost.
KSB has wonderful offerings for those seeking different levels of care. For mental health care, we offer individual therapy with clinicians at our clinic, which is located inside the hospital on the 2nd floor. We also offer group therapy. Currently, we have a coping skills group that meets once a week for those struggling with anxiety or depression or other mental health concerns and wanting some solidarity and some encouragement and learning some new skills on coping with some of those difficulties. We also have inpatient hospitalization. So if someone is in crisis and needing to kind of be stabilized and have support during that time, we can assist there with inpatient. And then we are getting ready to start an intensive outpatient program dealing specifically just with those who have a higher level of need that is not quite to the level of hospitalization, but more urgent than regular counseling services. And we hope to have that up and going soon, but it's a great way to offer another level of support for those in our community who may have a need for more urgent care. We also want to make sure that you are aware of what resources are out there for the community as well, beyond KSB and Sinnissippi. There is a hotline, 988, where you can call for help anytime, feeling any kind of suicidal thoughts or deep depression, anxiety. There will always be someone there that can answer. And another great resource that is geared specifically toward youth and families is the Safe to Help Illinois website. You can find that at safetohelpil.com. We thank you for joining us tonight and for giving up some of your time to learn more about stigma. We hope that we can all do our best to make a difference and end that stigma, that more people may find hope and healing. Thank you. Have a good night.